Thank you, Dr. Sood. Good morning, everyone. In February of 2015, there was a 51-year-old male officer who kept coming to the specialist concerned in Srinagar, and he kept complaining of frequent change of glasses. Now, this is his field. I'm just showing it to you. And this is, I've divided into two parts so that you can have a good thorough look at it. And this is of the left eye. And again, this is the lower part of the field. Now, the doctor concerned found that he had field defects in both eyes. So he started the patient on eye drop Travatan in February of 2015. And in our parlance, he was also placed in low medical category. Therefore, he was denied certain things which possibly he could have got. Therefore, he was at a loss. Now, do you think this was right? If I can have a show of hands as to how many people think that this was the correct form of treatment, I would like to have a look at it. How many of you feel that this was right? So, since nobody has raised hands, we realize this was probably not right at all. So, he came down to the tertiary care center in 2015 of November, and he was reassessed. And what did we find? That he had no family history of glaucoma. This gentleman was not myopic. He was not hypertensive or diabetic. We all know that these are high risk factors. His vision was 6/9 with just +1. His Paki was 515 microns in both his eyes, and he had 6/9 vision, as I've said, with +1. Paki was yes, and his pressures were normal. So we did a diurnal variation, and in the diurnal variation, it was absolutely normal. Mind you, first we stopped the drug, waited for a washout period of 1 month, and after that only we started the treatment. His pupils were normal in size and reaction. Gonioscopy was grade 4 open angles, but he was found to have a posterior subcapsular cataract in both eyes. And because he was found to have this, we also, despite the fact that he was 51 years of age, we hunted and looked at the retina for any signs of intermediate uveitis, and we found nothing. And so then again we repeated his fields, and now you look at his fields and you find in the right eye, he had a very reliable field, and his VFI was 100%. And you find that he did, and he had only, as look at his optic disc photographs, he had very large optic discs and a large cup. He had no field defects, and similarly in the left eye. And so, since this gentleman had no field defects, he had large, probably physiological optic cups. He had PSC, which was not interfering with his vision that much, and he was not willing for surgery. He was being followed up, and he's still being followed up 6 monthly. At this juncture, I would like to tell you all that I had another patient who was a colonel who was started on some treatment, and then I stopped his treatment. Kept following him up. After 1.5 years, that man developed reproducible field defects. So that means I always wondered to myself, should we not? Because when you are developing reproducible field defects, that means 30 to 40% or maybe 50% of your visual fibers have already been lost. But you must follow up every patient who is under your treatment for whom you have stopped the treatment. Now, there was this 30 years old lady, mind you the age, her pressures were approximately between 24 to 24 by NCT, and her fields were done by Octopus. And you can have a look at this, the upper part of the field and the lower part of the field. You can find that there are defects out here. MD was 10.5, and in the left eye, I'm sorry, this is the right eye. I'm sorry, it's a very, very old printout. That's why I'm sorry, it's poor quality. And you have a look at this, that she's got a small little defect in Bebe's curve, and her MD was -2.3. Now, in 2005, this lady was now started on Clocomol, and then it was changed by some other doctor to Primonidine. Then she was changed to Combigan. Then she was changed to Travacom, and then now Azop was added to Travacom, and that's the time in 2016 she came to me. And then I again repeated, and I found, oh my God, she really had huge defects in the right eye. This was 2014, sorry. And in 14, once again, we find now it's Humphrey fields, mind you. So you find that, but the fields were not repeated. You have to have a reproducible field defect in a possibly reliable field. And so we again, in 2017, now we did a field again. And we found that this lady had hardly any defects in the right eye. And you look at the defects in the left eye, hardly any defects in the left eye, and they were all reliable fields. So we again took what Dr. Naik did, explained the entire situation to her, said that, look, we have to act together, and since your vision is normal, your IOP is consistently normal, a diurnal variation was done for this lady every time we stopped her medication. CCT was within normal limits. Her gonioscopy was grade 3 angles. Her optic nerve heads, she had 0.6 cups with healthy NRR. This lady, we started one by one, we stopped the drugs, and we kept on watching out for any kind of field defects. And today, we found that in 2018, she had no field defects at all. Drugs were decreased, as I said, one by one over fields, and IOP is normal without any drugs. So this lady was, now I can say that perhaps put on unnecessary drugs because of just one field which possibly should not be done. A 53-year-old male who had 6/6 vision unaided, his pressures by GAT were normal, and maybe slightly raised CCT as per Indian population. He was diabetic, his fundi were normal. If you look at now, this is an oculus field, and you find an oculus field he had. Again, if you look at the PSD, the corrected detection, you find that there were certain field defects. And this is of the left eye, and again over here also almost a paracentral defect. And he was started on timolol in 2008. This timolol was again replaced by latanoprost with timolol because one IOP rise was seen by NCT. He was continued on these same drugs till 2011. And you look at the fields in 2011, we practically find that there was normal in the right eye. In the left eye, he had little less reliability. But you look at the defect was right in the center. He had a macular defect. Was it really glaucomatous? I really wonder. So we have now, in 2016, had a look. You notice that he's got a slightly tilted disc. His field is absolutely normal in the right eye. In the left eye, also slightly tilted disc, and a left eye also his fields were normal, except that he's developed, you can see a little field defect, 3 spots which are present right in the pattern deviation. All drugs were stopped, and the patient is now still on follow-up. Now, this was a 6-year-old girl. She was myopic. She was 6 years old. She had come for treatment for intermittent divergent squint. Now, at that time, this little girl was started on glaucomol because of certain field defects which were seen. Unfortunately, those field defects are not available with the patient, but now this girl was on treatment till she came in 2011, till she came to me in 2016. So you have a look, 2001, now she has a field defect there, and in the left eye also, she has a huge field defect, yes. So she continued with treatment in 2013. Therefore, this now was a 39-year-old lady who had high myopia. Her pressures were always normal. She had large optic cups. You can see the optic cups over there. Her NRRs were very healthy. She had very high fixation losses, but there were actually no field defects at all. And in 2013, also same thing in the left eye. Reliability was low. But she had a small paracentral defect. Was really the macula being affected? Was it an early defect with variable depth and location? So in 2016, when we had a look at her, we found that, now I'll try to complete this particular patient. We found that this lady had actually no glaucoma. She had high risk factors of high myopia. Her medicines were stopped. She's still continuing on treatment with me with no field defects and intraocular pressure within normal limits. So whenever we stop a patient from taking any drugs, we always follow up the patient because it's an additional responsibility for the doctor, because you've stopped drugs and you never know if really the glaucoma develops later on or not. Thank you so much for your time.